Today we are visiting with Dr. Kenneth Woeber, who first came to Mount Zion in 1975, a long way from his original home in Johannesburg, South Africa. He told us about his education there.
My first school, prep school, was Parkview Boys School, and then after graduating from high school, I entered the University of Witwatersrand, just called WITS, W-I-T-S, and ultimately graduated from medical school. Did my internship at the Johannesburg General Hospital. After completing my internship, I did a senior house officer position, they do call them residents, at Coronation Hospital in Johannesburg.
Along the way to Mount Zion, he continued to enhance his education at several interesting places. First as a research fellow at the University of Miami.
This was at the University of Miami, and what I was involved in was actually, originally I came to do cardiovascular research, but ended up doing endocrinology and metabolism.
He went on to serve at the Harvard Medical Unit at the old Boston City Hospital. He became a member of the Royal College of Physicians of Edinburgh. He served in the United States Army, and finally in 1972 he landed at San Francisco General Hospital as an Associate Professor of Medicine in Residence for UCSF. Shortly before his appointment at Mount Zion, Dr. Woeber was awarded the Distinguished Van Meter Award from the American Thyroid Association. Established in 1930, it is the association's oldest award, and it honors an investigator who has made outstanding contributions to research on the thyroid gland. For the next 25 years, Dr. Woeber found himself very busy serving as Chief of Medicine at Mount Zion. We asked him to tell us about his experience at Mount Zion.
Yeah, well, I was recruited here as Chief of the Medical Service in 1975, and at that time Harry Weinstein was Director of Medical Education, so we got to know one another quite well, and this relationship continued over the subsequent quarter century.
We asked him to tell us about some of the committees he may have served on.
Virtually every committee, starting from the medical board, virtually all the committees, because Chief of Service you were, or a surrogate was required to be on most medical staff boards that were involved in medical staff governance. So I was on a lot of boards. I was at luncheon meetings every noon basically. But also, I was very heavily involved in teaching third and fourth year medical students, and of course we had a residency program here. These are interns, first and second year residents, or what they call nowadays residents 1 through 3. The term intern has sort of gone by the wayside.
We also asked Dr. Woeber what his involvement with residents is today.
Now I'm solely involved in the Division of Endocrinology, and I run the clinical service at both campuses. So I'm primarily involved with fellows. The only time I have interactions with residents is when they are on elective rotation through the endocrine service. So primarily endocrine fellows who are post-residency trainees.
And we asked him about his current research.
Well, currently my research is primarily clinical now, since I'm heavily involved in patient care and to some extent in teaching. And the research is primarily clinical. Recent studies that have been done and published included the natural history of subclinical hyperthyroidism, looking at a cohort of patients that I see in the endocrine practices.
And we asked Dr. Woeber if he had any outside hobbies or interests.
Yeah, first of all, I love writing. In fact, I get very depressed if I don't have something to write. If I don't have research and writing up, then generally I will try and pull together some review article. but I do really enjoy writing papers, and I like tinkering with motors. I'm very interested in the way things work, so I'll tinker with electric motors, car engines. In fact, I once essentially rebuilt a car engine.
Most importantly, as a teacher, Dr. Woeber has guided many residents over the years and was honored with outstanding teaching awards numerous times. He was also made an honorary member of Alpha Omega Alpha, the Honor Society for Medical Students. And finally, Dr. Woeber's expertise as an endocrinologist and a physician who provides patient-centered care was recognized by the UCSF Department of Medicine when they honored him as part of the inaugural class to receive the designation of Master Clinician. We thank Dr. Woeber for his time today.